Okay, so the question on the floor is whether or not Medicare is better than an Advantage plan. And so I want to make sure that we don't use words like better than or the best, but what's suitable, what's appropriate, what's supportive of your own healthcare is really what we have to focus on. So here's what happens with original Medicare: A and B, that's hospital and medical, the red, white, and blue card. It is actually accepted in every state. There's no limitations to where you can go because everybody takes it. However, it's 80% of your health care covered by Medicare if it's medically necessary. Okay? So then the other part of it is that 20% is left to be spent by you. That's your part of that medical expense. In addition to that, there are deductibles and copayments. So there's a deductible for Part A, and there's a deductible for Part B, and you have a premium for Part B. So there's some costs associated with having Medicare. Additionally, if you don't have, if you get sick and you have an incident, for the first 60 days of that incident, come home, come back from the hospital, everything's fine. But you have an additional or a new incident 60 days later, you got to pay the deductible again for original Medicare. Okay, so now it's $1,680 for a one-time shot and 20% of the expense. What if it was a broken hip and the hip is $100,000? Now you have a $20,000 bill plus a $1,600 deductible. Just putting it out there. So unless you have cash money to pay for Medicare A and B, all the associated costs, you're on the hook for finances. Now, there are things like an indemnity plan, which will indemnify you or reimburse you the money you spent, but not the entirety. Or the Advantage plans, which you pay something, you don't have to pay anything monthly, but you have a deductible that is significantly less than that 20% because you have an insurance company like a Humana, an Aetna, a United, or somebody bigger, a carrier, that's going to offset some of the price. And that, for being their customer, they're going to give you their portion, and they're going to give you health, doctor, prescription drugs, and a few extra things like dental, vision, hearing, maybe fitness, even a meal, and even transportation. So they have advantages that are all booked together, whereas if you're just on original Medicare, you would be paying a la carte for everything. And you're required to have a Part D prescription drug plan. And you're required, well, if you want, to have vision, dental, and hearing, an additional $30, $40 a month for just that service as well. And then you still have to figure out transportation.